Hey everybody, it's Tuesday, July 21st, and I want to take this opportunity to take you through the context we find ourselves in, the risks as I see them, and the changes I think we need to make to our plan to address the situation. So let's get started. Um, the context for the situation we find ourselves in was laid down by President Stempard on May 1st. And when he said, "We will convene as a community to hold classes here at Hampden-Sydney College this fall, as we have for the past 245 years." I think all of us would love nothing more than for that to happen. However, holding classes as we have for the past 245 years was impossible during the spring, and the pandemic has only grown more widespread and more serious since then. So, if the college can responsibly open in the fall, it can only be because of the protection and risk mitigation present in our reopening plan. And I believe those protections and mitigations are currently insufficient. So the next few slides take us through the risks, and they are the same slides I distributed earlier, so let me be sort of quick with this. I think we all agree that the risk of an active infection on campus from day one is pretty much a certainty. Um, there's really no mitigation for this risk. Uh, the factors that make it a virtual certainty that we'll have infections all lie outside our control. So this is really not a criticism of our plan. This is just the reality that we find ourselves in. There's a risk of an outbreak on campus that I think we all agree is very high. An outbreak means that infections are spreading on campus. Um, the mitigation we have in place for that is very detailed in our plan, but it all basically boils down to masks, social distancing, and ventilation in the context of in person teaching and in person office hours. There's a related risk that I'd like us to discuss more in this group, and it's the risk that our college's resources become overwhelmed. By that I mean the college finds itself in a situation in which it doesn't have the resources to support, isolate, or quarantine infected community members. If that came about, it would be fair to say that our plan would have failed. And so, a goal of our plan should be preventing the college's resources from being overwhelmed. And I'll have a little bit more to say about that subsequently. The mitigation we have for this risk, again, boils down to masks, social distancing, and physical infrastructure improvements like ventilation. There are other risks. There's a risk to the college's survival, risk to the college's financial health, which we all agree is serious, risk to the livelihoods of college employees, risk to the college's reputation in its various dimensions. These are kind of hard to quantify, and again, the mitigation for them boils down to masks, social distancing, and physical infrastructure. So these risks lead me to my concerns. The first is that mask and social distancing are simply not enough. Masking can reduce infection daily growth rates by 1 to 2%, and that is meaningful. That's according to a recent study in Health Affairs. Masking is undoubtedly the most effective mitigation we now have, but compliance rates need to be greater than 80% for robust efficacy, from what I've seen. And to put it in context, a 2% daily growth rate means that infections are doubling every 35 days. In the initial stages of an outbreak on campus, the doubling rate is going to be much greater than that. And what this indicates is that in that case, masking and social distancing wouldn't be able to prevent the spread. Another concern is that the realities of student life at Hampden-Sydney College will severely limit the benefits of both masking and social distancing. There will be contact with the local community where the infection is spreading. And noncompliance with masking and social distancing in Farmville, in the bars, in the restaurants especially, at Walmart, is pretty high. So that's a definite risk. And there's also risk of noncompliance on campus. I think the classroom situation will be very manageable, but compliance outside of the classroom is a high risk factor. Another concern is, as I said, transparent decision making. The criteria for a college wide decision to suspend normal operations should be clear, explicit, and based on science and observable data, and they should be part of our plan. Moreover, the norms for decision making have to put health and safety as the number one priority, and I think that we need to state that explicitly in our plan. We all have a concern about lack of testing. Testing is needed for robust contact tracing. There are many other reasons for testing as well. And the fact that there are lags in the getting test results shouldn't preclude our maximum effort to obtain testing. I've looked at the number of students you need to test to get an estimate of the student infection rate. And it would, if you wanted an estimate with a margin of error of 3% at 95% confidence, you need to test 80 students. That seems doable. We could also use aggregate testing to determine hotspots on campus. I believe that to the extent that testing is lacking or limited, the college's reopening plan needs to compensate with increased protections for the health and safety of its community members. I'd like us to look as a group at, who is in charge of this effort to procure testing and how can we help them. A major concern is the limited mitigation options we have. Masking, social distancing, physical infrastructure. I would like to point out, remote office hours are mitigation. Remote on-campus learning is mitigation. A host of other factors that we could consider are mitigation, including clarity and transparency and incentives for public health, good public health citizenship. We need to look at all these very intently. The upshot, though, is that there's a lot of room to improve the plan's commitment to the health and safety of the college community while preserving the broad outlines of what we've promised our students and what we all want to do, which is A, preserve an on-campus experience for our students, with B, as much in-person interaction as is safely possible. So what changes do I think are needed? First, I think we need increased utilization of on-campus remote learning. Any student exposed to COVID-19, not just positive, but exposed, should be immediately transitioned to on-campus remote learning in all of his classes. We would need an unambiguous and, in my view, not overly rigid definition of what we mean by exposed here. And we would need also to talk about conditions for the return of students to the classroom. I also strongly believe that we need more latitude for individual faculty members to make a decision to take their classes remote. There's a spectrum of options here. At the sort of most permissive end, faculty could simply notify the dean at any point in the semester of a decision to move their classes to remote on-campus format, and they would need to give the reasons for doing so, but once they did that, they would be ready to make that change. An option with more oversight would be that faculty can petition the dean to move classes to remote on-campus format. I think a healthy respect for faculty autonomy would require the dean to respond quickly to such a request, say within 3 days, and that if he were going to deny it, he would need to give good reasons in that address the faculty member's health and safety concerns, and that state the reasons of why in-person instruction from this faculty member in this class is absolutely necessary. I'm sure there are other options we could consider here, but I hope we will be able to consider them. A related concern, I think we need an increased utilization of remote office hours. These need to be completely at faculty discretion, in my view. I think the faculty handbook already gives us that right. There's no language that specifies the mode of office hours, but I know that conversations with FAC are currently ongoing. I'd add that I consider it low risk that remote office hours would somehow significantly degrade the student experience here at Hampden-Sydney. In fact, I think that students would probably welcome that option. I think on the part of faculty also, there would be less opposition to in-person office hours if there were more flexibility in terms of remote on-campus instruction. So I think we need to consider these two things in tandem. As I said before, I think we need explicit criteria for suspending normal operations. There are actually layers here. One kind of suspension would involve taking classes across the board to remote on-campus instruction generally. So students would remain on campus, but instruction would be remote. A more serious decision would involve sending all the students home. We need explicit criteria for these. The health and safety of the college community need to be the number one priority explicitly in our plan. Needs to be based on science, observable data, college data, and with a goal of preventing college resources from being overwhelmed. As an example, if 50% of our isolation units were being utilized and infection was still spreading on campus, then the college might make a decision to send all students home. But whatever criteria we use, they need to be explicit, observable, and based on science. We need an intensification of our effort to procure testing for individuals, for groups, aggregate testing. How can this group help? Other ideas, incentives for good public health citizenship. Christian talked about reporting mechanisms. We could also talk about rewards for good behavior. We need to consider tightening restrictions on outside the classroom activities, athletic events, tailgating, colloquia, and so on. We need to consider tightening restrictions on student guests, tightening restrictions on student off-campus travel, because infection migrating from the local community to campus is a very real possibility. I'm sure there are many other ideas that we have here, and I hope we'll have a chance to discuss them. I'm sure we will. I look forward to our meeting tomorrow, where I hope we can discuss some of the ideas I've talked about here in a little more detail. Thanks for listening, and I will see you tomorrow.